Hello everyone, this is Dr. Sam and today we will compare the images of fetal brain. These are axial images. This right here is the skull bone. This hyperechoic line is the falx cerebri. And in the posterior fossa, this is the posterior fossa. And this bilobe structure is the cerebellum, and it is covered by the cerebellar vermis. And over here, this is a slightly different level, and this is the cavum septi pellucidai. It is an anechoic rectangular structure in front of the thalamus, and these hypoechoic structures are the thalami on either side of the falx cerebri in front of the cerebellum. Our first case is ventriculomegaly. It is the abnormal dilatation of the lateral ventricles. The diameter of the lateral ventricles must be less than 10 millimeters. The choroid plexus normally occupy the majority of the space. They produce cerebrospinal fluid, and over here the lateral ventricle diameter is more than 10 millimeters. If the diameter is between 10 to 12 millimeters, it is termed as mild ventriculomegaly. And we do not see this area clearly because of the near field reverberation artifact which occurs due to the skull bone. Because in the upper part of the image, the ultrasound beam has higher energy, so there are large number of reflections in this area. In moderate ventriculomegaly, the size of the lateral ventricles is between 12 to 15 millimeters. As you can see, it is larger as compared to mild ventriculomegaly. In severe ventriculomegaly, the diameter of the lateral ventricles exceeds 15 millimeters. The choroid plexus are hyperechoic structures inside the lateral ventricles. They produce cerebrospinal fluid and occupy most of the space inside the lateral ventricles. In severe ventriculomegaly, a condition known as the dangling choroid plexus occurs. In this, the choroid plexus will be reduced in size and it will appear to float inside the lateral ventricle or dangle. In aqueductal stenosis, the aqueduct of Sylvius, which connects the third ventricle to the fourth ventricle, is obstructed. This leads to dilatation of the third ventricle and the lateral ventricle. The normal third ventricle will have a slit-like appearance, whereas when it is dilated, it will have a rectangular appearance. Hydranencephaly is a rare condition in which the cerebral hemispheres are replaced by large, fluid-filled cavities. We do not see any brain tissue over here, with a little bit visualization of the thalami. One way to distinguish between hydranencephaly and severe hydrocephalus is the presence of some cortical tissue in the case of severe hydrocephalus. Porencephaly is defined as multiple cystic spaces inside the brain. Here we can see 4 separate cystic spaces. Schizencephaly presents as clefts inside the brain. There are mainly 2 types, open lip and closed lip. These clefts extend from the lateral ventricles all the way to the subarachnoid space, which means they will be reaching the skull bones on this image. In closed lip schizencephaly, the walls of the cleft are in contact with each other, which means there is no open connection between the cleft that reaches from the lateral ventricle and the subarachnoid space. There is no open connection.